just to preface this, Mari and Rabia were two of the 6 children of my maid, or my mother's maid, actually, while I was growing up. She had 6 kids, 4 girls, 2 boys, very aspirational, very intelligent, really wanted to, it's almost quite amazing that they were so, it's almost as if they transcended their own socioeconomic situation, and that they really looked, there was this gleam of hope that they had, that perhaps they would be able to get a quality education, perhaps they would be able to really extricate their families out of poverty. And I think that whenever I used to ask Rabia, you know, what would you like to become when you grow up? And she would regularly say in Urdu, oh, main to nutty professor banungi, which means, translated, that I want to become a nutty professor. And she was very inspired and motivated by the Jerry Lewis movies, which we were all very fond of, and so that was part of her inspiration. And when I came back from college during one of my winter breaks, I saw the same Rabia who had been sparkling, a brilliant spark, if you will, completely extinguished and jaded. And I was really disturbed by this, and I was like, you know, what happened to you? You know, you were the spark in your family. And what basically had happened is that her father, who was a mechanic and the primary breadwinner in their family, had had a stroke, was taken to a public sector hospital, public facility, was not treated in time or adequately, or seen in time, had a complete, essentially, hemiparalysis, was essentially rendered completely incapacitated, and racked up significant medical expenses, both during that acute phase and then in the post-stroke rehab phase. And essentially, his wife, our maid, felt it beneath her dignity to just take charity, and so she actually wanted to earn her way through and repay the medical bills. And so she actually made the conscious decision of taking her 6 children out of school and putting them in the urban child labor markets. So many of them ended up working in houses, etc., etc. And so a seminal event, which in this case was a stroke, a catastrophic major medical event, actually had a significant impact on the on that entire generation and on their entire trajectory in terms of their ability to take themselves out of poverty. And so this is something that stayed with me throughout my college, medical school, medical training. And then a few years back I said, you know, there are so many of us that, as I said, have been blessed with resources, expertise, knowledge. We've really enjoyed the fruits of what I would call of capitalism in the United States, and have learned to perhaps adapt that to a more compassionate capitalism in the developing world. And for me, and I guess my message today is that it's compassionate capitalism that I believe is going to be the way of the future, and that will really be a sustainable way for corporations, for-profit entities to really sustain themselves and continue to make profits in this world while taking care of people and planet.